you've heard anything about Medicare Advantage, you've probably heard that it's really just if you're healthy, and we even have a video dedicated entirely to that topic. However, it really is much more nuanced than that. So in today's video, we're going to do a deep dive into the long-term cost implications of Medicare Advantage based on different health scenarios. Now, if this is your first time to our channel, it really is our goal to make sure that our viewers and our subscribers are empowered in making decisions about their Medicare coverage. Making the right decision about your Medicare can really be the crucial difference between having a comfortable retirement or one that is, well, less than comfortable. If you have questions about Medicare, we're certainly here to help. You can reach us in the comments below or at the number on the screen, and we're more than happy to help answer any and all Medicare-related questions. So as I said, in today's video, we're going to look at those long-term financial implications of not only Medicare Advantage plans, but Medicare supplement plans as well. We're going to look at some real scenarios and real numbers and talk about what those implications could be, not just now, but for decades to come. So let's jump right in. Before we get to the hard numbers, I want to give you a brief rundown of the differences between Medicare Advantage and Medicare supplement plans. Now, if you're already a pro at this, take a look in the description below for the video chapters and you can jump ahead to the next screen. So it's completely understandable why so many people confuse Medicare supplement plans and Medicare Advantage plans, but really they are entirely different. First and foremost, with Medicare supplement plans, there's sometimes an out-of-pocket maximum, but that's not usually the case. The exception to that would be plans K and plan L because those are the cost-sharing plans, so there are some more significant out-of-pocket costs with those plans as opposed to the rest of the Medicare supplement plans. With Medicare Advantage plans, there's always some type of out-of-pocket maximum. Additionally, with Medicare supplement plans, there's going to be medical underwriting if you choose to enroll outside of that initial 6-month window. This means that your eligibility and your premium rate can be determined by your health. Now, that is not the case with Medicare Advantage plans. There is no medical underwriting, which is why so many people wind up trapped in a Medicare Advantage plan when really a Medicare supplement plan would probably be better for their needs. Additionally, with Medicare supplement plans, those costs and benefits are standardized. So if you choose Plan G, the benefits are going to be the same regardless of who the carrier is. With Medicare Advantage plans, it's much trickier. Those benefits are not standardized. The benefits and costs can range widely, which is why they are so much trickier to shop for. That being said, very often the deductibles and copays and coinsurance will of course be lower when compared to original Medicare. Now, with Medigap plans, there are no additional benefits. No dental, prescription drug, hearing, vision, etc. Very often Medicare Advantage plans, however, will offer these additional benefits to entice beneficiaries. Now, on to some of the good parts of Medicare supplement plans. There are no referrals and no pre-authorization. So with Medicare supplement plans, because you really still have original Medicare, you don't need to have a PCP, so you don't need a referral to see a specialist. That may be the case with Medicare Advantage plans, depending upon whether you choose an HMO or a PPO. However, regardless of whether you choose an HMO or a PPO, with Medicare Advantage, there is always the issue of pre-authorization. That is because Medicare Advantage plans are managed care plans. So if your doctor recommends a specific service or treatment or medication, your insurance carrier must first approve. This can mean a lot of paperwork, a lot of hoops to jump through, a lot of time which you may or may not have. And of course, with Medicare supplement plans, because we're talking about original Medicare, there are no networks. If your doctor accepts original Medicare, and almost all do, they will accept your supplement plan. With Medicare Advantage plans, there are of course networks. They can be rather restrictive because many doctors simply don't like contracting with them, largely because they are managed care plans. So now that you have a better idea of differences in things like pre-authorization and networks, let's switch gears and really talk about the finances. So I want to talk about premiums, deductibles, and copays and coinsurance, and of course that out-of-pocket maximum. So now let's take a look at 3 real examples of people with different healthcare needs and how Medicare Advantage might play into that. But before we do, a brief reminder to please like this video and subscribe to stay up to date. We do expect that there are going to be some major changes with Medicare. That is to be expected on a regular basis, but now more so than ever, we do expect that there are going to be larger changes coming down the line. So please make sure to subscribe to stay up to date. And of course, if you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. That means we work for you, not the insurance carrier, and there's absolutely no charge for our services. All right, let's get back to it. So for our three scenarios, let's talk about somebody with pretty average medical needs, someone with more extensive medical needs, and someone who's really looking to maximize the coverage of their plan. So let's start with the basics. Let's start with an example, we'll call her Denise, with somebody that has less extensive, more average medical needs.
Meet Denise. Denise is 65 and takes very good care of herself. She exercises every day and has average health needs. She goes to the doctor once per year for her annual checkup and actually doesn't take any medication. Denise knows from watching this channel that she can enroll in a Medicare Advantage plan that will give her access to additional benefits like dental, vision, and prescription drug without an additional monthly premium. Denise also knows from watching this channel that she should enroll in a PPO as opposed to an HMO to give her more flexibility if she does need to see doctors that are out of network.
So Denise opts for a Blue Cross Blue Shield plan, which is actually offered at no additional monthly premium. She just needs to continue to pay for her Medicare Part B. Denise uses her Medicare plan for her preventative care and yearly vaccinations, which with Medicare are offered at no additional charge. She does end up needing to go to the doctor a few times a year and also urgent care for some minor illnesses and injuries, but because she doesn't need to be hospitalized and has no major medical care, she really only ends up spending a couple of $100s out of pocket.
As the years go by, Denise's medical needs change, which is to be expected. She now has to take a few basic prescription drugs for her cholesterol and her blood pressure.
But Denise's current plan does not cover prescription drugs.
Luckily, Denise reviews her plan every year with her broker during the AEP. She chooses a Medicare Advantage plan that offers prescription drug coverage. She decides to stick with Blue Cross Blue Shield because she feels comfortable with the doctors and hospitals she's been using. Her new plan costs $25 per month, and her medications are covered with no additional copay. She now needs to see specialists a few times per year and has more regular medical testing. Still, her spending comes in around $1,000 to $1,500 per year, premiums included.
Even if Denise were to need more extensive medical care, her Medicare Advantage plan has an out-of-pocket maximum of $5,900. Now obviously that wouldn't be ideal, but if Denise continues to maintain average or good medical health, then it's likely that she would save money with her Medicare Advantage plan.
If we were to compare that with a Medigap plan, for example Plan G, then we are looking at a yearly monthly premium total of $1,140 if she were able to get a plan on the lower end of the spectrum. Now adding into that your $257 deductible, then your total yearly spending would be $1,397. Now, on the opposite end of the spectrum, if she were only able to get a plan with one of those higher monthly premiums, then her yearly monthly premium total would be $4,188. Add into that Part B deductible, then her yearly total medical spending would be $4,445.
Even though we are going to be focusing on the numbers in today's video, it really is important to remember that choosing between Medicare Advantage and a Medicare Supplement plan is more than just those numbers on a page. It's really hard to qualify the value add of the flexibility offered by a Medicare Supplement plan. Remember that should you be in a dire medical emergency, if you're diagnosed with a serious medical condition, then having that flexibility is more than just the financial freedom that it offers. It offers you the choice to choose between doctors and specialists because there is so much more flexibility with a Medicare Supplement plan. That can quite literally mean the difference between life and death. That's not to say that there aren't Medicare Advantage plans that offer you much more flexibility, especially when we're talking about PPOs versus HMOs, but it is important to note that regardless of whether you have a PPO or an HMO, it is never going to compare to the flexibility offered by a Medicare Supplement plan. Let's take it a step further. For our second example, let's talk about someone who starts off as pretty healthy with regular medical needs, but then during his second or third year on Medicare develops a chronic condition who requires more extensive medical treatment. Let's call this person Ben.
This is Ben. In the first few years of Ben's retirement, he maintained good physical health. However, he's recently been diagnosed with COPD.
So what happens to his costs as he needs more medical care? And he will need more significant medical care with more visits to doctors and specialists, inpatient and outpatient care, and of course more prescription drugs. On Denise's Medicare Advantage plan, he would likely meet his out-of-pocket maximum, and this means he would spend thousands of dollars every year in medical care.
Fortunately, Ben retired to Florida, where Medicare Advantage plans are just much better than in the rest of the country. Since he's in Florida, Ben has many plans to choose from. he makes sure to pick a PPO that offers prescription drug coverage, and he's able to find a plan with a $0 monthly premium and low premium and drug cost. It also has a pretty low out-of-pocket maximum for in and out-of-network services. Because Medicare Advantage plans are so much more competitive in Florida, it's actually unlikely that even with his heightened medical needs that Ben will meet his out-of-pocket maximum. As you can see, many of the additional services, if in-network, are offered with low or even $0 copays. And even if Ben should need an extended stay in a hospital, he can access a plan that has a $0 copay for days 6 through 90.
So as we saw with Denise, Ben would likely have thousands of dollars of bills out of pocket with his Medicare Advantage plan if he were to live somewhere else. Additionally, he might find difficulty finding doctors and hospitals who accepted his Medicare Advantage plan if he didn't live in Florida. So if he were to live someplace else, then a Medigap plan might be better. Finally, let's talk about Frank. Frank's health has taken a turn for the worse, and he's been diagnosed with end-stage renal disease. So how does Medicare Advantage affect that?
This is Frank. Frank lives in Texas.
So first and foremost, for someone who's interested in a Medicare Advantage plan that has some type of chronic condition, you may want to look into a C-SNP, or Chronic Condition Special Needs Plan. So in this example, we'd be looking for a C-SNP for end-stage renal disease.
So Frank is looking at some of those C-SNPs, and again, he's looking at PPO to give him more flexibility. Now, the C-SNPs available to him, yes, there are some with a $0 monthly premium, but you'll notice, wow, those out-of-pocket maximums are pretty darn high. And with Frank's health concerns, it's highly likely that he is going to meet his out-of-pocket maximum. Additionally, you'll notice that Frank will have to have some significant inpatient as well as outpatient care, and there will be significant costs there as well. Frank will most assuredly be seeing specialists as well as having many diagnostic tests. And Frank will, of course, need dialysis, and it is a 20% coinsurance in or out of network, and that is rather significant.
So it's likely that Frank will have to pay up to $10,000 per year. But more problematically, Frank is on the waiting list for a kidney transplant. And because Medicare Advantage plans are managed care plans, Frank needs permission from his insurance carrier. This means he needs to jump through multiple hoops to get that approval. This takes time which, quite frankly, he doesn't have. So what would happen if Frank had chosen a Medigap plan instead? Remember, with Medigap, there is no pre-authorization, so Frank does not need to jump through these hoops. There are no networks, so as long as his doctor accepts original Medicare, and almost all do, Frank will really have his choice of doctors and specialists and hospitals. And there's no PCP required, there's no HMOs and PPOs, so Frank does not need to refer to his PCP to get a referral to see a specialist. For someone like Frank, Plan G would be ideal.
So if Frank can get a plan on the lower end of the spectrum, he'll be in great shape. $142 per month times 12 is $1,680 for the year. And then if you were to add that $257 Part B monthly premium, that brings you to $1,937 in medical spending for the year. That's not including Part D, of course. We'll get to that in just a minute. Now, if he was on the higher end of the spectrum, and this is a pretty broad spectrum, so I wouldn't anticipate he would see this, it would be $7,740 per year. Again, adding that $257, that would bring his yearly spending to $7,997, which still brings him in under that $10,000 that we were looking at. Again, I would anticipate that he could see a lower monthly premium than $645, though. For Part D plans, I put in some of the more common prescriptions associated with end-stage renal disease that I put in also for Medicare Advantage. And as you can see, it really just ranges depending upon the medications that you're taking, of course.
So it's pretty obvious to see that, yes, in most cases, Medicare Advantage plans do tend to work better for healthier people with more average medical needs. That's because they offer those lower monthly premiums and very often offer additional benefits not offered by Medicare supplement plans. This can certainly help you save money. And if you're somebody with more average medical needs who perhaps doesn't need access to a litany of specialists and higher than average medical care, this can be a great way to have access to quality medical care without spending a fortune. On the flip side, if you're somebody who wants more peace of mind or who has more extensive medical needs, then a Medicare supplement plan is probably right for you. So why shouldn't you just enroll in a Medicare Advantage plan now and switch to a Medicare supplement plan further down the line? Unfortunately, that's where things can get a little tricky. So, for most states, Medicare supplement plans, you actually only have a period of 6 months after you turn 65 and enroll in Medicare Part B to enroll in a Medicare supplement plan without medical underwriting. Should you choose to enroll after this 6-month window, then you may be subject to medical underwriting, which means you could be charged more or possibly even denied outright. Now, there are some states where there are some exceptions, and there are exceptions overall. For example, if you're enrolled in a Medicare Advantage plan and you move out of your network area, or if you're in that trial right period within the first year of enrolling in a Medicare Advantage plan, you can still make the switch with ease. However, outside of those real exceptions, unless you live in one of the states that offers a more flexible Medicare supplement plan enrollment, then if you don't enroll within that 6-month window, you can be stuck in a Medicare Advantage plan, unable to make the switch. So deciding between a Medicare Advantage plan and a Medicare supplement plan really comes down to a few factors. First of all, your current health. If you're already experiencing serious medical issues, then it's highly advisable to go with a Medicare supplement plan as opposed to Medicare Advantage. If you live in some place like Florida, where Medicare Advantage plans do tend to be a little bit better and more flexible, then you might want to go for a Medicare Advantage plan to save money. If you're planning on moving further down the line, then perhaps you could enroll in a Medicare Advantage plan and make the switch later. If budget is a major concern, if your health is a major concern, if your risk tolerance is a major concern. These are all things to take into consideration when making this very, very important choice. So what do you think? Medicare Advantage or Medicare supplement plans? Let us know your thoughts in the comments below. Of course, if you have questions, you can reach us there in the comments or at the number on the screen. As I said, we are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. And if you want to learn more as to those state exceptions and guaranteed issue rights, definitely check out this video over here, because there are some changes coming down the pipeline. And if you'd like to learn more about Medicare in general, make sure to check out our All About Medicare playlist. Before you go, make sure to like and subscribe. We'll see you next time.